From what I see, the balance of mental health and youth health is a balance between access to social media for help and access to social media for harm across those things, and it's never a black and white answer. So I will throw this open to everyone. I think I'll take all of my 5 minutes on one question. Can you each go around and, from your perspective, what is that balance and where does it sit in relation to this bill?
So I do not see any benefits for mental health from social media. I've looked really hard at the evidence, and even if there were to be some, I think they are far outweighed by the disadvantages. But for mental health, I do not see any.
The thing that Headspace is concerned about with the social media ban is what we do hear from young people, and the research does indicate, is that there's help seeking that goes on online. There's seeking out of information with regards to mental health and wellbeing, and definitely with regards to connection, particularly for those young people that may be at risk of being disenfranchised, so remote rural communities belonging to minority groups and so forth. So places where they find connection online that otherwise they can't find in real life.
The Australian Child Rights Task Force has actually warned that those who are well-intended policymakers here who are trying to protect children and young people may actually be risking their participation rights as enshrined under the UN Convention on the Rights of the Child. So while we need to tread very carefully, or we risk dialling back young people's rights and pushing them into more isolated, less supported spaces.
It's really interesting to look at the latest research on phone bans, because it shows that there's a great report that's just come out that shows that socioeconomically disadvantaged girls do better in their academic results. There's less bullying, and there's also, they're saying, less need for mental health care as a result of those bans.
So do you agree there should be less time on social media?
Absolutely, because in both the research, and I work as a clinical psychologist and I research this, and I have been doing it since phones came into students' hands, into being owned by students. So I've been researching this. When you limit social media use, depression and anxiety gets better, invariably.
Oh no, I've seen it on veteran mentors, 3 days. It's like drug and alcohol. They will have withdrawal symptoms. So you take those phones off them for 3 days and they're not even looking at them on their 10 days. They're not even going to their bags and getting out their phones. They're saying goodbye to everybody. That's what they're doing.
And they're paying attention to each other.
And they're paying attention, and they're actually talking to each other. So what mental health issues are you speaking about if you cut this off?
Suicide is the leading cause of death for young people aged 15 to 24 in this country. And our colleagues at Reach Out have found that 73% of young people turn to social media for mental health support. Now, we might prefer that they go to other areas and other channels to seek out that support, but the reality is, for many young people, this is support that they simply cannot access anywhere else. Many refer to access barriers, strain on the system, living in regional areas, hugely under strain. And I've spent a lot of time this year in the Hunter Valley, where I've spoken to young people in those communities who are up against it. And so for them, we know that tragically, social media has had catastrophic consequences for some young people. But cutting it off altogether will have catastrophic consequences for other young people. This is a very nuanced and complex issue. For young people, it's not as much of an issue as switched on or off. Social media and technology is ubiquitous in their lives, and it's so different to the world that we grew up in. But booting them off social media isn't going to wind back the clock so that they can live the childhoods that we did. It's going to invariably nudge them into darker, less safe corners of the internet, where they will face exponentially greater risks of harm, extremism and exposure to awful content. A quote from a young person, Reese from Tamworth, who commented that social media has helped me figure out and become comfortable with my sense of self, is that as there is a large community that is able to connect me with people all over the world. Living in a regional area, it's difficult to find people dealing with the same personal developments, and social media really helped.
Believing that social media bans would solve the problem is naive, but it's potentially part of a solution, but we really also need to be thinking about broader responses that are not simply about developing clinical services, as important as these are and as much as we need them, but we really need to be investing much more in building preventative environments that are much more socially engaging, rewarding and respectful of young people. And we are not currently investing sufficiently in that. Currently, our investments are, if you like, the ambulance on the bottom of cliffs.